Chris. So how are you feeling after the teaching component of our session today?
I think it's okay. I might need a few practices. I'm not too sure.
That's okay. We're going to do a practice round now so you can get comfortable with the skill, and I can give you some informal feedback while we do that so we can correct things as we go. Okay? So are you feeling comfortable with the equipment? Do you understand what everything is being used for here today?
I think so.
Yeah. So we've got our ties, we've got spare ties if you need them if you make a mistake, we've got tape, we've got scissors if we need to adjust the length, and then obviously we've got our airway management trainer system here with a ETT in situ. Okay, fantastic. So can you give me some safety considerations around tying off an ETT?
Maybe I need to know the level where it sits.
Yeah, absolutely. So because we want to know that we're ventilating the lungs and not the stomach or not just the bronchus and one side of the chest, we absolutely need to know where the ETT is sitting when it's first gone in, and then if we've done a chest x-ray after the fact. Absolutely. So we need to know exactly where it's sitting. Anything else we need to know or we need to consider about the patient perhaps? Potentially if there's any gurgling that we may need to check our cuff pressure, just make sure.
Maybe I check this one?
Yeah, absolutely. So that's our cuff, that's our balloon, and we can use that just to assess and see if there is any air, any leaking around the ETT, especially before we tie it off, and if we need to move it. We may need to insert further or withdraw. Okay, fantastic. So can you show me the technique about how we go tying it off? Do you remember the sort of sequence of the steps available?
I think I need the tape.
Absolutely.
And the ties.
Absolutely. So I've already got one pre-prepared here for you. And you remember we do the slit.
Yeah.
Yeah. And why do we do the little pants slit style for the tape?
Maybe to secure it on the face and on the tube.
Absolutely. So we're using part of the tape as an anchor and part of it to secure it to the face. Fantastic. So you go right ahead and you show me how you affix the tape to the patient in the ETT. Yeah, so you might want to you could even start on this side potentially, or we can move the ETT across. If your assistant, your second person was in fact here, we would be moving it across, but for the purposes of our sim, we are pretending that it's only one person.
Maybe like that.
Yeah, fantastic. Fantastic. So I'll pretend to be your second person and you'll hold it here.
Where am I going to secure this?
Yeah, so you want to secure it as close to the lip as possible while still being able to see where the markings sit against the teeth or the lip.
So maybe, I don't know, maybe it's sitting at 11.
Yeah. So if we check, maybe we'll just go back a step. Let's check and see where our ETT is sitting. So it's sitting at 11 centimeters at the teeth.
Yes.
Yeah, fantastic. Alrighty.
Do I tape it now?
Yeah, absolutely. So we'll tape it now.
I think this is how you showed it to me.
Yes. Yep. Fantastic. Okay, so next step, what are we going to do?
I think it's secured.
You think it's secure there? Okay. So different hospitals do different practices, but at the hospital that we're training at, we actually have 2 points of securement. So we use our tape and we also use our ties. Yeah. So we have some ties here for you to use. And do you remember the technique, the looping technique?
Yes, I think you showed me.
Yes.
Yes.
that's right. It's very easy to forget some of the steps sometimes, and that's why we're doing the practice round now. So that you can get some feedback and some little reminders so that when you do your teach one session, you feel more confident.
Do I go on top or below?
Look, you can do either. We just want it to be as secure as it possibly can be, and we want to ensure that we have one point of securement above the ear and below the ear on the other side.
Am I doing it right?
You are. That's fantastic. You're taking your time, which is really important because this is not a race. We understand that an artificial airway is very precious and that if a patient loses it, it's a medical emergency. So taking your time is just the right thing to do.
Maybe.
Okay.
You're happy with that?
Fantastic. Are you happy with that? If this is your patient and your airway, does that feel secure, as secure as it can be? Sometimes you can have a second person, an assistant, just place a finger to secure the ties further.
Maybe that's probably what I need. Yep.
Yeah, fantastic. Alrighty, that was a great job. Feeling a little bit more comfortable and confident now?
I think so. With that practice session, I think I needed that.
Excellent. Well, I think now you're ready to move on to your teach one. You did a really good job. As I said, it's just forgetting a couple of steps here and there, and practicing those sequential steps will become easier the more exposure you get to the patients and the more you do in clinical sim. And so Mary Chris has now done her teach one session, so we're going to informally go through some feedback and have a bit of a discussion. So, Mary Chris, how are you feeling about how you went?
I think I really needed to be guided and reminded about the safety things. There's a lot of things probably to consider before actually doing it.
Do you think utilising your checklist may be helpful in future as well?
Definitely. I think a checklist and someone senior beside me would help me do this safely and more confidently.
Absolutely. So you actually answered most of the criteria on the checklist really well. It was really more confidence around the areas, and it seemed like there was a little bit of confusion about the number of ties, tapes, etc. that you found a little bit bamboozling. That's really normal because it is a multi-step process that requires a lot of practice. Similarly, ETT markings, just trying to remember that, bearing in mind what those are, where they are, and why we're checking it in case there's a change. You did really, really well. So I've used the checklist to assess you against, and you've essentially fulfilled all the criteria. So what I want to understand now is that we've gone through a little bit of feedback. What do you think you could take into the future with your practice? Do you have any goals in terms of performing this skill now?
I would definitely not do this myself. I would go through the policy first and then go through the checklist and then have maybe the senior person to be with me a few times before I can feel confident and competent to do this for the safety of myself.
Absolutely, and they're all very reasonable, achievable goals, and that's also promoting patient safety, which is ultimately the most important thing. I think, as a novice, efficiency and confidence will come with time and experience, so that will not happen overnight, but the important thing is in terms of safety is that you did take your time, so that was extremely well done. So after this session, do you feel that you've met the intended learning outcome of being able to demonstrate securing an artificial airway?
Definitely.
Fantastic, because that was the ultimate goal of the session today. And do you have any concerns or anything you feel like you could have improved upon?
I think I just really need to keep practicing and go through the checklist so I don't miss anything.
Yeah, fantastic. Once again, very achievable, very easy to do looking forward into the future, which is the whole point of why we try to focus on feeding forward as opposed to just looking back at our performance. So at the end of this study session, you'll get an evaluation form from a QR code. We'd really appreciate it if you filled that out. It just allows allows me to ensure that the education I'm delivering to future students and cohorts will be the best that it can possibly be. So that would be fantastic. But well done, and thank you so much for your help.
Thank you.
Thank you. Thank you. Bye.